is a procedure that utilizes hyaluronic acid to supplement the thick synovial fluids from your knee joint, which cushions, lubricates,
osteoarthritis, and the main goal of the injection is pain relief. The risks and benefits of the procedure have been reviewed with the patient and the appropriate consents have been signed. We're going to be demonstrating a lateral infrapatellar approach with the patient in a seated position and the knee flexed to 90 degrees. At this point we'll identify the important landmarks for the injection and mark the injection site. So our landmarks will be the patellar tendon and the tibial plateau, and our injection site will be approximately 1 centimeter lateral to the patellar tendon and 1 centimeter superior to the tibial plateau. There's usually a soft indentation at that site, which is where we'll mark for the injection. At this point, with the skin marked, we'll prep the skin, and we typically will use betadine and or alcohol to clean the skin. The medications that we're going to be using today will be, again, a visco supplement, and with the skin prepped, we'll now use a topical anesthetic, which is ethyl chloride spray. Spray for approximately 5 seconds, about 6 inches away from the skin. This helps with the initial needle stick and for comfort to the patient. So again, with the injection site marked, we keep the needle perpendicular to that and advance the needle and inject the medication. If you encounter resistance with advancement of the needle or injection of the medication, we just reposition slightly until the needle or medication moves smoothly. We apply a little pressure after the medicine is injected, and we'll clean off the excess betadine and apply a Band-Aid. The patient is also given post-injection care instructions, and we'll see him in 1 week for third injection of visco supplementation. With the patient in a supine position and the knee extended, we will identify the important landmarks for the procedure. And for this approach, the main landmark is going to be the superior and lateral aspects of the patella. Once you've identified those landmarks, we'll identify the injection site, which is approximately 1 centimeter down from the superior and lateral edge of the patella. Our next step will be to prep the skin using betadine and or alcohol solutions. Our medications that we're going to be using today will be 2 milliliters of a 1% sodium hyaluronate solution, and for our clinic we use Euflexa, but you can also use Synvisc, Hyalgan, or any other visco supplement. We're also going to be using a 22 gauge 1.5 inch needle for the injection. For skin anesthetic, we're going to be using an ethyl chloride spray. And we'll spray the skin for approximately 5 seconds, about 6 inches away from the skin. This will help with pain relief from initial needle insertion. Keeping the needle perpendicular, we'll advance it slowly and inject the medication. Again, if you encounter resistance while advancing the needle or injecting medication, reposition slightly until it flows smoothly. Again, clean off the skin from excess betadine and apply a Band-Aid